So before I start going into the details of the tool, I'd just like to give a few words of introduction and why did we create this tool. So as you are aware, the WHO has recommended PrEP for populations at substantial risk, which they have defined as roughly incidence of 3% or above. And a number of incidence surveys have started to come out, mostly the FIA surveys. And even in countries with the highest incidence, there is not one that at a national level or at any of the subnational levels that have been captured in these surveys has shown incidence above 3% in adolescent girls and young women. On the other hand, we know from clinical trial data, most recently the ECHO study, but many clinical trials of HIV prevention among women in sub-Saharan Africa, that there are most certainly populations of adolescent girls and young women with incidence far above 3%. And another piece of the puzzle is that a lot of these clinical trials haven't actually done selection of the clinical trial participants based on behavioral risk. Instead, they've focused on communities that have ongoing high levels of transmission. And to that point, researchers who have tried to come up with risk scores based on behavior, in general, these risk scores have not performed well when applied to different settings. So what that suggests to us is that risk among adolescent girls and young women in sub-Saharan Africa has more to do with the setting in which they live than it has to do with their specific risk behavior. As long as they're sexually active, they don't necessarily need to have a certain number of partners or a certain age of partners or STIs or anything like that. If they're in a place with high levels of transmission happening, they're at risk. So then the question goes, if we don't have information about incidence among adolescent girls and young women, mostly we don't have it below, at best, maybe the provincial or regional level. And even if we had it at the district level, it might not, we might need even more finely grained data. So how do we actually identify populations of adolescent girls and young women that would meet a particular criterion for being provided PrEP when we don't have the incidence data? So that's the reason why we have created this tool, is to try and identify these populations, really even at the level of a catchment area of a service delivery, that could be prioritized for PrEP based on some user-defined criteria of either impact, cost effectiveness, or cost savings. So that's what this tool is doing. Now, we wanted this tool to be able to be very simple as possible to use. We didn't want the users to have to collect finely grained incidence data. We thought that that would make it impossible. We didn't want the users to have to conduct complicated modeling exercises that require the gathering all kinds of data that would make it prohibitive. So we did some research, and through this research, we found two simplifying assumptions that this tool is based on. So the first one is that we found that you can predict the incidence among adolescent girls and young women ages 15 to 24 in sub-Saharan Africa based on their prevalence. You can improve that prediction if you also have prevalence among 10 to 14-year-olds. You can improve the precision of that prediction. What that means is that if you have a program and you have a positivity rate among adolescent girls and young women, you can get a rough estimate of your incidence. And if you have even better, if you have an estimate of the prevalence among 10 to 14-year-olds as well, you can get an even better estimate of your incidence among the 15 to 24-year-olds. So that simplifies the inputs needed for the tool, meaning that you don't have to be collecting incidence data. The other simplifying piece that we learned through our research is a lot of people are interested in not just the infections prevented among the young women who are taking PrEP, but what about their partners and their partners' partners, all the downstream infections averted? Generally, you would need modeling in order to assess the downstream infections averted. And when we started this, we thought that it would probably depend on things like the prevalence among men, the ART prevalence, the prevalence of male circumcision. And so we initially started thinking that we were going to try and get an equation that would relate these things to the downstream infections averted. But as it turns out, when we did this research, we looked at the downstream infections averted among a number of different countries with different types of epidemics. And the percentage of downstream infections averted compared to the primary infections averted doesn't actually really vary that much across all of these countries. So that made the tool even simpler. We don't have to put in the ART coverage. We don't have to put in the prevalence among men. We don't have to put in the VMMC coverage. We're just using a single factor for the downstream infections averted. Done. So that simplifies the tool. And that comes from this research that we did across 8 different countries in sub-Saharan Africa using the GOALS ASM model. So now let's just start looking through the inputs on the tool. So one thing that you'll notice is that this tool has now been integrated into PrEP-it. So we started out with a standalone tool, and it was decided that it could be integrated into PrEP-it, and that would make it the most useful and most user-friendly. So that's what we've done. Everything on this page, this is a tab within PrEP-it. So if you tell the tool that you want to set targets for adolescent girls and young women, it'll tell you that you have to fill out this tab. Everything that is orange is for user entry. And we've filled out some things with some defaults that the user, if they want, can change. So we've started out with some default levels for PrEP efficacy based on clinical trials that have been conducted previously. So for PrEP efficacy, we put 90%, and that can be modified by the user, but that's what we're suggesting as a starting point. We put in 75% for, we're calling it effective use. So what this means is it can also be called adherence, but we don't want it to call adherence because that can sometimes be confused with continuation. So effective use means you have PrEP in hand, what percentage of your population is actually using it enough to get the effect. And that can be defined differently for different populations, but that's, you know, we're putting in something for adherence or effective use. So the user can modify this. The 75% came from, I don't remember which study. I think it was the recent study in South Africa, but I can't remember which study. It's from some published data about actual use of PrEP among adolescent girls and young women. And then the user can put in a discount rate. 3% is commonly used. What the discount rate does is it affects how much value you put on things that are happening now versus in the future. So if you have a discount rate of 0, you don't care whether something happens now or if it happens in the future. The higher this number is, the more weight you put on something that's happening now. I'm not as concerned about money that I'm going to spend in the future. I'm more concerned about money that I'm going to spend now. And I'm not as concerned about impacts that are happening in the future. I'm more concerned about impacts that I'm having now. And that can have to do with the uncertainty. It can have to do with inflation. Levels that are commonly used for discount rates are like 3, 5, 7%. And you'll see with the different discount rates how that changes your output. So you can try that and see how it changes the results. Oftentimes people will use a range of them when they're doing an exercise like this. So the next piece is, what's your threshold criterion? So what that means is, am I going to set my threshold based on either, are there any cost savings, which is a very stringent criterion for providing PrEP, or am I going to set it based on a particular amount of PrEP cost per HIV infection averted, which could potentially be less stringent of a criterion. So something can be cost effective without being cost saving. And so you might want to, if you want to relax your criterion, you could change this to cost per infection averted and then set your threshold here. Right now we're just going to keep it at cost savings, but you can see if I change it to cost per infection averted, the user has to enter a threshold. And we're not providing any guidance to the users about how those thresholds can be set. It's an entire science within health economics, which is kind of beyond the scope of this tool. So because this tool is connected in with the rest of PrEP-it, we're giving the users the option to vary their PrEP cost by area. And if so, they need to fill out the detailed costs tab in PrEP-it. Right now we have it set to no to simplify things. But if users want to start getting fancy, they have the ability to get fancy by connecting them with other modules of the tool. The next piece is, what's the cost per person year on PrEP? This is pulling from the other modules of the tool. So if you've filled out cost slate or detailed costs, this is going to pull from what you've entered in the other modules of the tool. Otherwise, you can overwrite this and just put a number in here. And we're just going to skip this for now. We'll come back to the gray boxes below. So the next thing that the user needs to do is enumerate all of the geographic areas or catchment areas or sites that you're going to be assessing whether you want to provide PrEP. So these can be districts or they can be sites. You would put the names in. If it's a district over here, if it's a site, you can put it here. And then for each one of these, let's just call them sites, you're going to put your prevalence among 15 to 24-year-old adolescent girls and young women. So again, this can be a positivity rate from your program data. It doesn't have to be survey data. If you have it, you can put in your prevalence among 10 to 14-year-olds. Again, that improves the estimate of the incidence. It improves the quality of the outputs of the tool, but it's optional. If you want to know the total impact, you can put in the number that you want to initiate. If you want to use this to set targets, you can put the population size of adolescent girls and young women in that particular area. And then you need to put in continuation rates for each of your sites. These can be the same for all of them, or they can vary by site or district, depending on what data you have available. And then the last piece that the user is going to enter is the cost per person year on ART. So this can be the same all the way across all of your sites, or it can vary if you have data about how it's different in different places. So then once you've filled everything out, the tool is basically highlighting those districts or sites that fit the criteria that you've set. So you've set the criterion as total cost savings. So everything in yellow here means that in that particular site, based on the dummy data that we've populated the tool with, in all of those yellow highlighted sites, there are cost savings of providing PrEP. So the cost of providing PrEP is less than the cost that you're saving from not having to give ART to people. So you can see that it's told you in all of these areas, PrEP is cost saving. If you want, again, a less stringent criterion, you can put in some other number here, and it changes which areas are highlighted. So then it's just highlighting the ones where the cost of PrEP per HIV infection averted is below whatever number you said. It was 15,000. Okay, so the other thing that it's doing is, if you want to connect this with targets, it'll tell you, if you've already entered the population sizes, it'll tell you what's the total population of AGYW in the highlighted areas. What is the prevalence among AGYW in the highlighted areas? What is the total PrEP costs in the highlighted areas? What's the cost savings? And then here we have, if you didn't do any targeting and you provided PrEP everywhere, this would be your cost savings. If you do targeting, this is your cost savings in row 14. So you can actually see there's a difference of $435,000 if you do target versus if you don't target. So that's a 10% additional cost savings by focusing only on those areas that are below your threshold. And then everything in this tab connects into the target module of PrEP-it. So it's putting in the population size from those areas that you've selected. It's putting in the HIV prevalence from those areas selected. And then if you want to do further selection of your population based on some sort of risk behavior, you can put some other number here in terms of the percent indicated for PrEP. So for example, if you say, in those catchment areas, I'm only going to offer PrEP to adolescent girls and young women with 2 or more partners, then you would estimate what percentage of your client base has 2 or more partners and put that percentage in here. And then if you can say, I want to reach a certain coverage of those who are eligible, then if you're setting your targets based on option 1 coverage, then you can still put a different percentage other than 100%. So let's say, like, of all of the adolescent girls and young women who are eligible in all of the selected catchment areas, I think that over my target setting period, I'm going to reach 50% of them, so I'm going to put in 50% coverage. And then it connects in with all of the rest of the tool in terms of the target setting, costing, and all of the other outputs of PrEP-it. So that is the introduction to this module.